Another record-breaking day in this pandemic. Coronavirus hospitalizations in the U.S. approaching 101,000. That is an all-time high, according to the COVID Tracking Project. And to make things even worse, the 911 emergency medical system throughout the United States is at a breaking point. That is a direct quote from the American Ambulance Association in a letter obtained exclusively by NBC News. That group now asking HHS for more relief aid as hospitalizations skyrocket. In North Dakota, only 12% of staffed hospital beds are available right now, and EMS workers there say they feel forgotten.
Most states, they do not list EMS as an essential service, which makes it hard for us to get federal funding or even state funding. I feel like we are kind of forgotten. We're a vital source. I mean, yes, hospitals need to be there, but how do we get people to hospitals?
NBC News correspondent Ellison Barber is at an EMS station in Jamestown, North Dakota. Ellison, that is so disheartening to hear. Of course, EMS workers are essential to us. Private EMS companies, as we know, got $350 million back in April collectively. But that money ran out pretty fast in a matter of weeks. What kind of relief, what kind of help, what are they asking for right now?
Well, they say they could use some more federal aid. This company that we've been with since yesterday, they did get a check back in April, but they say they haven't gotten anything since then. The other big thing they say is for EMS services to be deemed essential. Police and fire, they're considered essential, but Allison, only about 10 states actually list and consider EMS ambulance services essential.
Ellison, that's just wild. Tell us more about Jamestown, where you are. It's a rural area, and from what I understand, major cities like Fargo and Bismarck are 100 miles away. If you could just put that into context for us, I mean, what does that mean for these EMS workers every time they get a call?
Yeah, I mean, just look at this ambulance bay where we are. They have a total of 4 ambulances here. 3 of them are staffed 24/7. If you look down here right now, you'll see every single one of those, they are out. Earlier today, at one point when all 3 of these were out, 2 of them were on COVID-19 calls. One was for a COVID 911 call. The other was a call for them to move a COVID-19 positive patient who was on a ventilator from the local hospital. They went to go get that patient and then take them to a hospital in Fargo. That ambulance, unless this is them coming in right now, this is one of them, they haven't come back yet because that drive is going to take them an entire 5 hours just to get that patient to the hospital where they need to go to. So these guys, their resources are strained, and they say it is taking a big toll on them. Listen here.
We treat almost any call as a COVID call. I would say anywhere between 70 to 90% of our calls day to day are true COVID calls. When you get to, like a COVID floor at a hospital with all these COVID patients, and you can hear all of them coughing, and a lot of them are actively dying in those hospital rooms. And that takes a big mental toll on you.
We're a profession that has to roll with the punches. We've always been that way, and we're very good at it. So when we say that we're struggling to run with or roll with the punches at this point, it's bad. I watched a news report like 6 months ago that said, could you imagine a world where you call 911 and an ambulance doesn't respond? And that's a very real possibility for places where we're not deemed essential.
So this crew coming in, I looked to see who it was in the front. This is not the crew that went to take the patient to Fargo. That crew, they are still not back yet. They've been gone at least 3 or 4 hours by now. That's one of the challenges for ambulance services like this. This is the only ambulance service in Jamestown. They serve about 100 miles. Traveling those long distance, not only does it take their limited amount of paramedic teams out of service for this local area, it also puts a lot of wear and tear on their ambulances. And they say that not only are their resources strained, they're getting more and more calls for COVID-19. Their people are tired, but they also say that they are running out of money. And they were at a breaking point, they say, before the pandemic, because they didn't have a lot of funds to begin with, and it's difficult for private services to get them. Put a pandemic on top of that, and they say that many services, particularly in rural areas and ones even smaller than this, they are already at their breaking point or past it. Allison?
Oh, Ellison, it's just an unbelievable situation that they are in, yet they continue to go out and try to help people, try to save lives every day. Thank you so much for shining a light on the need they have there and in rural areas across the country. Appreciate it. One of the leading hospitals in the country ramping up to roll out the coronavirus vaccine. NBC News Now correspondent Dasha Burns takes us inside a new facility at Duke University in North Carolina, where they're getting ready to vaccinate 20,000 employees against COVID-19.
Hey, Allison, at the end of this grim week in the pandemic, everyone is looking for a little bit of hope. And here at Duke University Hospital, this room represents that. This is a space where hopefully in just a couple of weeks, there will be people getting vaccinations. And it may not look like much right now, but even this space has had so much thought and planning put into it. They had to find a room big enough where they could put these vaccination stations at least 6 feet apart, have some social distance here. Now, getting a shot, it only takes a couple of minutes, but this is a vaccine that will require a 15 to 30-minute monitoring period because some people will likely have some COVID-like side effects. So they're going to be monitored right over here. They'll have some snacks set up for people while they hang out. Now, this room is right next to the hospital. That was a strategic decision because the first people that will be in these seats, they're going to be those frontline workers, and many of them will have to go right back to work after this as long as they're feeling okay, because they're going to have to be taking care of those COVID patients. And Allison, this is just one piece of this symphony that has to come together in perfect harmony. Think about just some of these other logistical layers that we've learned about here in our time at Duke Hospital. They have to think about getting these ultra cold freezers we've been talking about so much, getting them delivered here. That's happening in the next few days. They have to have the right equipment to install them. Now, those freezers right now are going to be empty. They don't know when the supply is going to come, how much of it they're going to get, how often they're going to get it. All of that is going to impact the planning. They have to think about having enough syringes, needles, sharps boxes. They have to think about the timing. That's going to be critical because as soon as you get one of those vaccines out of the freezer, the clock starts ticking right then and there. It's only going to be okay in the fridge for a few days. And then once that vial is opened, there are 5 doses in there that need to get into arms immediately. So they're going to have to plan this process out perfectly, schedule everyone to a T so that they don't waste a single dose of this precious vaccine. One person who's thinking about all of this right now is a man named Jason Zivica. He heads up emergency management here, and he has a lot on his mind right now. Take a listen.
Right now, there's a lot of unknowns. We don't know exactly when they're going to arrive. We don't know exactly how many we're going to get. Are we going to have all the supplies with them that we need, or do we have to dip into our stockpiles in order to make sure that we have the right equipment? And there's a lot of logistics that go into this that we need to make sure that we have down because we want to be able to provide this vaccine as quick as possible to those who want it.
And Allison, one final and perhaps the most important component here is staff. So many members of the team right now are treating COVID patients as North Carolina is seeing these record numbers of hospitalizations, but they also need people here to vaccinate. So there's a major recruiting effort right now trying to get people to take part in this. They're trying to get retired nurses to come and work on this effort. So it is all hands on deck right now, Allison.
The U.S. seeing a record number of COVID deaths, cases, and hospitalizations for a second straight day. We're talking 219,000 new cases, almost 101,000 people in the hospital, and more than 2,800 deaths yesterday alone. Here's what Dr. Anthony Fauci told Savannah Guthrie on Today.
Is this worse than even you had feared?
Well, I think it's at least as bad as I had feared.
I want to bring in Assistant Professor of Emergency Medicine, Dr. Anand Swaminathan. Dr. Swaminathan, what does Dr. Fauci mean there? How bad is this pandemic right now, and how bad could this get?
I think what we're seeing is pretty bad. It is worse than we expected in some ways. And at the same time, people like Dr. Fauci, they anticipated this. We're seeing huge surges, and those surges are larger than the surges that we saw in April and May in New Jersey, New York. And as those surges mount, what we're seeing is the hospitals fill up. We don't have beds. We're boarding more patients. The ICUs are full. And we still haven't really probably hit the surge that's coming from Thanksgiving. And that doesn't even take into account whether people have learned or not to do the gathering again with the upcoming holidays. So we might see another spike after Christmas, and that's obviously very concerning to us. So I think it's bad right now. It's probably as bad as it was in April, May, maybe a little bit worse, and it's probably going to get worse in the next couple of weeks.
California Governor Gavin Newsom is out with some new restrictions that are tied to ICU bed capacity. Things like shutting down non-essential businesses, only letting restaurants offer takeout and delivery if a region in California's ICU bed capacity drops below 15%. What do you think of that strategy? Is that effective? And is there anything else you'd like to see states like California doing here?
It's a reasonable idea, but it might actually be not anticipating enough. Waiting until beds drop below 15% might be too late. We're not really sure, but I think we need to be really on top of this and anticipating more. I think the shutdowns that Governor Newsom is calling for are reasonable. We need to see more of that. There's no reason to have indoor dining right now. I understand the economic problems, but that is a hotbed for spreading this disease, especially as community levels of the virus rise. Any indoor space where you're in there for a long time, masks are off, it's going to be a huge risk. So we need to stop those kind of things. Essential or non-essential businesses should be closed for indoor services because that's such a place to spread this. So I think these are good recommendations, but they might need to be ratcheted up a little bit and more anticipating of what's going to be coming.
A vaccine still has not been approved for use here in the U.S., but that could happen as soon as next week. And there's still a lot of questions about how states will roll it out. What are your biggest distribution concerns?
We've talked about a lot of these concerns with the temperatures that it has to be held at, getting it ready to be distributed, the limited amount of time we have after pulling it out of the deep freeze. All of these are problems. One of the things that we haven't talked about as much is the fact that this vaccine needs to be given twice, 1 month apart. So even if we capture people for that first dose, we need to get them again in a month to get re-immunized or get the second dose, I should say. And that's going to be very challenging. We know that follow-up is hard. Our hardest hit populations, those who have marginalized healthcare, it's going to be even harder for us to get those patients back for that second dose. We don't know if you get one dose of Pfizer, if you can get a second dose from Moderna. We don't know vice versa. We don't know a lot about how to do this exactly the right way. And I'm worried that there's going to be a lot of people who get one dose and then we don't recapture them for the second dose, which means that we haven't had the effect of that vaccine that we need. These are real challenges that we're going to have to address over the next couple of weeks as the vaccine becomes available, and then over the months coming as we're able to extend that vaccine to the rest of the population.
How about Black and Latino communities? We know communities of color have been disproportionately affected by COVID-19. What are your concerns about racial disparities when it comes to vaccine rollout?
I think we have some of the similar issues to the getting patients captured. Having this in doctors' offices, even if they had the freezers available, is probably not going to get to those marginalized populations, those without healthcare access. And so our hospitals, maybe schools need to play the role of these central distribution for the vaccines, places that people can get to whether they have healthcare or not, whether they have access to appointments or not. We need to make that readily available. We need to be using things like text messaging to remind people, you got to come back in 4 weeks so we can get that second dose in. And there are lots of other marginalized populations, even more marginalized, that we have to worry about. So patients who are homeless, how do we get those patients vaccinated and then back for the second vaccine? Prisoners is a big concern for me because that's a hotbed for the spread of this disease. At least we have them in one place where we can get both doses. But these are huge challenges that we really have to figure out good systems, and that needs federal leadership. Municipality, county leadership is not enough here. We need federal leadership to tell us the best ways to do this, to provide us with the right supplies, the right support so we can get to patients, and then we can keep track of them and get them back for that second dose.
Dr. Swaminathan with St. Joseph's Regional Medical Center, thank you so much for coming on. Your first visit to us on the evening show here at News Now. I hope you'll join us again.
I would love to. Thanks, Allison.
See you soon. In the small rural town of Fredonia, Kansas, health officials are fighting hostility and skepticism over COVID-19. It's making it hard for them to put things like mask mandates in place to control the virus and protect the community. NBC News correspondent Antonia Hilton takes a closer look at this growing animosity that's even putting vaccine planning on the back burner.
Dr. Jennifer Bacani McKenney is one of only 5 doctors at the small regional hospital in Fredonia, Kansas.
In our new one, we can do high-flow, invasive, bypass, everything.
That's right. Okay.
She's also the county's health official, responsible for planning the community's COVID response. Lately, it feels like an impossible job. 9 months after the first COVID case seen in Kansas, health officials like McKenney are losing support with residents who don't want to hear any more about masks and social distancing. Some drive by her house, post about her on Facebook, and push for her to get fired.
Hello. I'm giving you a big hug.
Dr. McKenney was born and raised here and says she knows almost every one of the town's 2,500 people. But now she sometimes feels like an outsider.
What do you think is motivating the tension in town?
I think there's a lot of fear and there's so much unknown. People want to blame something and they can't blame a virus that is too small to be seen. So they blame people like me.
At the end of November, she got a small win. After months of debate, town commissioners put a 30-day mask mandate in place. But at the meeting's end, the sheriff's deputy escorted Dr. McKenney out.
We are in the process of losing our freedom. We're in the process of losing free speech.
That was a first for me. But when I asked them why they wanted to walk me out, they said, well, we're worried about your safety.
Disinformation and distrust of government, many depending on hourly wage jobs at the few restaurants and shops around, and fear being asked to quarantine. Their anger spills out onto administrators and contact tracers like Destiny Wheeler.
We hear that this is a lot, and how are they going to pay their bills? And I know these people. I don't want them to not be able to pay their bills or not be able to go to work. And that does get really personal. It's very hard.
In the first 7 months of the pandemic, the community had 60 confirmed cases. In just the last week, they've seen 80.
My whole body's sore. It feels like I got hit with a vehicle. Lost a sense of taste and smell.
Are you worried at all?
I live with and take care of my 93-year-old great-grandmother, and that's something that I'm worried about.
Do you wish you'd worn a mask?
A little bit sometimes.
20 minutes later, both men got the call. They're COVID positive.
This is Harviette and Van.
Dr. McKenney says she'll keep showing up for her patients and working to combat pandemic fatigue.
Do you think that will solve the division in town?
I think it's going to take a while to solve the division in town because it's personal. It's hard. People have said things, people have heard things, and even if we're physically safe from the virus, there are a lot of hurt feelings. What I worry about is that it's going to take much longer to get through that than it would be to get through the actual pandemic itself with the virus.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.